A recent investigative study says men buying testosterone on the internet has potential health pitfalls. A Northwestern Medicine study published in the December issue of JAMA Internal Medicine found a concerning trend between 2017 and 2019. The number of visits to direct-to-consumer online portals claiming to treat erectile dysfunction jumped 1,500%. Men should always talk to their healthcare provider before considering purchasing testosterone treatment sold online. Why men seek testosterone treatment? Testosterone is a male hormone produced by the testicles in men. This powerful hormone is known for boosting energy levels, building muscle mass, and preventing erectile dysfunction. Men experiencing decreased fatigue, low muscle mass, and trouble getting or maintaining an erection often seek testosterone treatment to remedy these issues. The definition of testosterone deficiency is having together low levels of the hormone along with symptoms such as low energy and low libido. These guidelines state specifically safe and effective management for men using testosterone therapy. Study design. The research team used a secret shopper to evaluate 7 US-based online companies selling testosterone therapy in all 50 states. The secret shopper claimed he was 34 years of age and had symptoms such as low energy and low sexual desire. Researchers found many gaps in counseling, such as covering the risks and benefits of therapy and offering testosterone therapy to men who do not meet the guidelines for testosterone deficiency. Some of the key findings included: only one of 7 online platforms asked the secret shopper about any recent cardiovascular events or about their future fertility aspirations. 50% of the online companies had a treatment goal of more than 1,000 nanograms/dl testosterone levels without mentioning fertility risks. 83% failed to discuss the risks of polycythemia or increased blood thickness. 6 of the 7 online platforms had no threshold for treatment initiation and were not following the AWA&S guidelines. Why online purchases of testosterone can be dangerous. The problem with online portals selling testosterone directly to men, without being evaluated by their healthcare provider for testosterone deficiency, is the potential for health risks, including fertility. Many platforms selling the hormone do not offer appropriate medical counseling to review the potential dangers of using testosterone treatment if a man is not deficient in the hormone. The problem is that men purchasing testosterone online are seeking ways to improve their quality of life, but without having to see a doctor first. In addition, some men like the convenience of buying online and not having to discuss with a doctor embarrassing issues such as erectile dysfunction. The U.S. Drug Enforcement Administration regards testosterone as a controlled substance. This is why testosterone should only be prescribed by a medical doctor who has evaluated a man of their need for testosterone. If the evaluation does show a man to have low testosterone levels, then the doctor will prescribe the medication through a man's pharmacy. A healthcare provider must regularly monitor men using prescribed testosterone as it is not without risks. These risks include blood clots raising the risk of heart attacks or stroke, infertility, increased red blood cell counts, an enlarged prostate, and an increase in sleep apnea symptoms. Bottom line: men should be extremely cautious before considering purchasing testosterone through any online portal. Numerous pitfalls can seriously affect their long-term health when using these platforms that do not follow AWA&S guidelines. These guidelines set the standard for diagnosing men with low testosterone and then how to administer an appropriate and regularly monitored treatment while taking this medication.